So Dr. Ben, so many people struggle from atopic dermatitis. Is that the same thing as eczema?
Well, not exactly. Atopic dermatitis is sort of a bigger category. Seborrheic dermatitis is included in that, and we've talked about that on one of our videos. Eczema is included in that, but you know, I like to separate them out because there are some people who just have dry, itchy skin, and it's not always because of the same causes as eczema. So in this video, we should talk about eczema as on its own and what causes it. In fact, why don't we start there? Perfect. Eczema is an amazingly common condition, and you see it in infants and you see it in adults, and some people have new onset and some people have it coming and going, and it's all very explainable, and it all comes back to our dear old friend candida. Candida has a unique strain that creates the eczema condition, and people get confused because they're like, well, how could candida cause this acne in this person and eczema in that person and something else like seborrheic dermatitis in another? And the pictures vary because the toxins that each of these strains emits have a different effect on the body. So the answer on eczema is that specific strain. The way the skin tries to deal with it is it tries to detox the skin by shedding the skin. And of course it gets red and inflamed. The way you treat it is, of course, by just controlling candida. We use harmonized water to rebalance the yeast population within the gut. And it's incredibly effective. But I wanted to explain why infants get it. What's happening is the mom gets it. So often pregnant women get candida because of the, whatever peanut butter ice cream and pickles or whatever they're doing, but not just that really. It's actually the hormones, and the surges of hormones promotes candida. So women end up building candida in the system, then they pass it on in utero to the child. So children, like in their very early ages that have eczema, that's where they get it. But then, of course, kids can have it anywhere along the way. They could, let's say they had a bunch of ear infections at age 2. The next thing you know, they've done several rounds of antibiotics. They develop the candida condition. They get eczema. So it can happen throughout your life. But it is more common to see it earlier on because you're more likely to have it. And like I said, the water is very, very effective at helping your body rebalance the population of yeast in the system. And then topically, we have some anti-inflammatories that are effective, but honestly, people would spend so much money doing that, right? If you had eczema in a lot of different locations, some people just have it on their hands and other, small locations, that might be possible, but certainly not for a pretty significant bout of it. And again, we're trying to treat something permanently by essentially giving the body the tools to heal the source of the condition.
So how does somebody know the difference between eczema and just atopic dermatitis?
Atopic dermatitis is really going to be more about dry skin and itchy skin, and eczema, of course, can be itch quite a bit, but it's going to be red and flaking and much more raw, inflamed, yeah.
Got it. Thank you.
Uh-huh.